Hi, everyone. We are continuing our video series in celebration of Nurses Week. I'm Carrie Koenig, Vice President of Patient Experience and Communication, and today I have with me two very special guests who I'm going to ask to introduce themselves to you. Yolanda, do you want to go first?
Hi, Carrie. Thanks for having me. I am Yolanda Buford. I'm the Assistant Regional Operations Director for the Southern Maryland branch of MedStar's Home Care. I've been in nursing for about 15 years now. Been with MedStar just under 3 years as an ops director. And really, it's a great agency to be working with. So I'm happy to be part of the MedStar family.
Great. Thanks, Yolanda. How about you, Mabel?
Good afternoon. My name is Mabel Abbas. I've been a nurse for about 40 years. And I came to MedStar VNA about 28 years ago. And I was in the field for about 18 years and then moved into Director of Operation 2007. And I enjoy working in MedStar Home Health because compared to all other home health agency, I think we are the best. So I'm happy I'm here. So,
but you're not biased at all.
No bias.
And Mabel, you're from our DC agency.
Yes, I'm from Washington, DC.
All right. How about you, Sharon?
Hey, I'm Sharon Wilner. I am the operations director for our Blue Team, which is in our Central Maryland agency. Been a nurse for 25 years this month. And I've been doing some sort of home care since 2000. So it's been something that I've done most of my career, some type of home health. So, yeah.
And tell us, Sharon, what do you like most about home health, being a home health nurse?
What I've always loved about it is the one-to-one. You really can make a difference, seeing how patients are in their homes, what their caregiving support is, what they might need, which is something you don't always see in structured hospitals or nursing homes. So it's really a way to keep people home, taking care of themselves, taking care of their loved ones, and really do a lot of teaching. So I really enjoyed that part of home care over the years. So
great.
Yeah.
How about you, Yolanda? What made you become a home care nurse?
Oh, wow. So I was an ER nurse before, and I always wondered, what happened? How did you get here? What happened? And for those patients who you kind of got to know, because they returned to the ER, it really was that question. How did you get here? What was missing? And I had a dear friend who was working as a hospice nurse at the time, and we were talking about that exact question. And she said, if you come over to work for hospice, you get the answer to that question. And it just so happened that the agency that I actually went to work for, Holy Cross, at that point in time, many years ago, right, had both a home care and a hospice agency. And so that really, solidified for me that answer, and how I, as a nurse, had a significant individualized impact on the what happened and how do we prevent this from happening again. And so for me, having a career in home care has been an amazing experience. Just the blessing and benefit of being able to really touch people's lives in such a poignant way has really been a good trajectory for me.
That's really interesting. Well, so tell me, what made you make the transition from direct patient care, where you were directly impacting patients in their lives in their home and really seeing what was challenging for them, transitioning to a leadership role?
So it really kind of happened unexpectedly. I think I was really serving a role more so as what we would call a mentor, clinical mentor in our field. So, that hybrid between, precepting new hires, still providing that direct patient care, providing, that educator type of support. And it just so happened that an opportunity became available where I felt I could really teach people, associates, other clinicians, what I knew, and teach other clinicians about my perspective on home care. The biggest part of that is compassion, customer service, and having a greater impact on like-minded coworkers to say, we can all kind of have this same impact, and so that was very exciting for me to be able to really make a significant difference in the lives of other clinicians, especially new grads or new hires to home care. I've had, people even reach out and say, oh my God, I remember you from, when I first started my career, and I've always taken what you told me to heart. And so it's been a really good transition into leadership. Absolutely.
That's fantastic. Mabel, I want to ask you a similar question about leadership. But what would you say, you've been in a leadership position for a long time and a nurse for a very long time. So what would you say are some of the most challenging things that you experience in your leadership role?
Oh, in my leadership role, especially when I came on initially, it was hard for me to, if we have a nurse that it's very mouthy, that can talk, yes, that one can be a challenge, was a challenge for me, until when I talked to my immediate supervisor then, and was able to learn from her that, all right, you need to talk to this nurse one-on-one to really understand what's going on their end. And then let her know what you want her to do. And by doing that, it has really helped to deal with all these clinicians.
So the coaching part.
Yes, the coaching
was the most
part,
challenging.
Yes.
Going from a frontline nurse to then being the nurse coach.
Yes. Yeah. So
that's very, very much related to what Yolanda was saying, being that mentor and that coach and that educator. Are those similar things what are some of the things that you enjoy about being a nurse leader?
Being a nurse leader now, because I'm not dealing with the clinicians only, I'm also talking to the patients, because sometimes when they have questions about, oh, Miss Mabel, how come I'm not getting a visit today? And then I look it up, everything, and then it's going to be like, oh, your visit is no more 3 times a week, it's now 2 times a week. So your visit is now going to be this date and this date. And then sometimes they ask me, like last week, one of them asked me, what do you mean by decreasing my visit from 3 to 2 times a week? And then I explained the protocol to the caregiver. And at the end of the conversation, this lady was so happy. And to the extent that was even emailed me and said, Mabel, can you give me your manager's name? So I had to give her Kira's name and email. And she wrote a recommendation to Kira, thanking me for that short period of time that we talked about the protocol and how it works and all that.
That's so nice.
Yes.
Sometimes people just need information, right?
Yes.
And a good explanation.
Yeah. Yes. So
that's great. Sharon, can you tell me, I know some of you operations directors, you are overseeing, I feel like it's up to a couple of 100 patients on a given day, could be on your team's census. I know you oversee anywhere from 30 to 50 clinicians, and then the amount of patients that they're seeing. A similar question to Mabel's, what would be some of the things that you really find are the most challenging overseeing such a large team of patients and clinicians?
I think home care, the one thing that it can be kind of not a misconception, being a remote workforce can be difficult for communication, difficult for understanding what's going on. But I I try to make that less difficult, and making sure that the team that I work with, they know that they can reach out if they have any concerns. You know, a large census, I think, is actually a good thing. So we try to make it a positive as a team, and we try to really make sure that we're working together, that they know that they can problem solve with me. You know, with the large team, with the fact that we're so remote. If there's any challenges these days, it's that we don't meet once a month together face to face, you know, since the pandemic. But we do meet once a week as a team. We're all remote. And so it'd be nice if we could be together. So for now, the challenge is that we can't actually be physically together. But we do touch base often, almost daily, most of us. So, and they know how to reach, they know how to reach me. They know how to reach their team members. So, I think we're doing pretty good. The challenge is really just our opportunities to see what we can do better. And, I think we do pretty well. My favorite part of the job is the teamwork. So, as long as we're strong communicators and, we're all open, I think we do pretty well. So
that's great perspective. Communication and teamwork, right?
Right.
Yeah, that's what makes the world go round.
That's it.
I've been asking the other nurses that I've interviewed this week. We've talked about how nursing really defines who you are. When you become a nurse, it's not really something that you can turn off, that it really becomes part of your nature and who you are. And I want to ask all of you about being a nurse and being a leader. If there was one thing that you could think of, and Yolanda, I'll start with you. One thing that you wish people knew or understood that you really don't think that they understand about being a nurse leader or being an operations leader in your case, what would that one thing be? What do you wish that people better understood?
That it's very easy to become, unfortunately, disconnected from your passion simply because the passion that spurred us to stay in our field was that direct patient care and making sure that everyone gets what they need. And when you are providing that direct patient care, you really have that control. When you step into a leadership role, you don't really have that tight of a control over the direct patient care impact, unfortunately. And it does cause for me a little bit of discontent, because you want to just hug everybody and say, it's okay. I know the nurse was running late or the therapist was running late. I am so sorry. Let me come over right now and make it better. You know what I mean? And so just that little disconnect from being so close to the patient, I think is something that I would wish everyone knew, that we care so deeply about every single patient that comes through the MedStar family. And if we had a magic wand, we would fix it all right then and there. There would be tons of staffing available. Everyone would, have all their ducks lined up every single day for every single visit. And, it is definitely not for lack of trying or caring. That compassion and customer service is something that drives me all day, every day. And I do wish that people understood that sometimes it's just a matter of being so far removed from the direct patient care that you kind of lose that personalized touch. But at the heart of what we do, we are still nurses. And I know that I am happy to FaceTime and troubleshoot an IV line, making those joint visits in the home are real good opportunities to really continue to fire that passion of direct patient care. It's always there, but yeah, we're still nurses at heart, and we still care very deeply for our community.
That makes a lot of sense. Thank you for sharing that. How about you, Mabel? How do you feel? If there was one thing that you wish people knew or understood about being a nurse leader or an operations leader, What would you like to share with them?
You know, just like what Yolanda was saying, that is something that I really missed too, because so many patients when I was in the field, because of my personality, quiet, and then easygoing, is when I get to their house and say hi, 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 and they answer, they'll be like, okay, it's like they already made up their mind that, oh, I don't think this one knows what she's doing. And then, so then it's like when I open up, especially the IV case, then open up and then was able to take care of the business. And then at the end of the whole thing, everything taken care of, giving them all the instruction to do, to follow, and even what to do when there is a problem or there's an issue. Then that was when they said, like, Mabel, I'm so sorry the way I took it when you came in. Because of how quiet you are, that's why we were thinking like that. But you really know what you're doing. And can I call you next time? Or can you now be my primary nurse? And so we just take it from there. And it's like, yes, I can be your primary nurse. The only thing is we have zip code by zip code. But as long as it's within my zip code, yes, I'll tell them I'm coming, just call me anytime. And they call and then we chat about it. Even if there's nothing going on, we can just talk and then they'll be so happy that we were talking and every situation was taken care of. But all those things is missed right now because I'm in the field and because I'm in the office.
Yeah.
So no direct patient care anymore. So with little chances I get when they call and able to walk them through whatever the issue is, oh, that makes my day. That really makes my day. And the patient tells me too, oh, Mabel, thank you so much. Thank you for calling and fixing all the problem. So I really miss it. I miss that direct patient caregiving.
Yeah, I feel like from what all of you have said, I feel like all of us really miss the direct connection with people. Even like I believe it was Sharon who was talking about staff meetings when we used to see people in the office coming in. I know that we all miss that, or the joint visits, like one of you said, being able to go out with your clinicians on those visits and having that opportunity to connect with your nurses and therapists and aides and social workers, in addition to having that patient connection. Yeah. I know all of us look forward to going back to the times when we got to have more of those opportunities. Yes. All right, Sharon, I want to close it up with you. If you could tell me similar question, if you could tell everyone one thing that you wish they understood about being an operations leader, you wish people knew, what would it be?
Well, for me, I'm pretty sure we can all say we got into nursing because we like taking care of people. And I went into the leadership role wanting to continue to take care of people. And the people that I feel I like to think I take care of are the people on my team. And so, as a nurse leader, I want them to have the tools that they need to do their jobs well. I want them, to know that we all work together. We all have the same goals. I care about them. I care about the patients in the fields. I care about the people that I work with every day. If I don't know the answer, I will always reach out to my operations team and get some more information, whatever we can do to problem solve. But again, for me as a leader, I feel like I'm taking care of a different group, and it might not be that patient in the home, although I'm perfectly happy to talk to them as well. But again, I would like to think I take care of my team as well. So that's me.
Thank you all so very much for sharing your perspective today. It's been great having you, Sharon and Yolanda and Mabel. Tell us a little bit more about your role in nursing leadership and how your past experience as nurses really impacts your daily interactions with your clinical team members, your other leadership colleagues, as well as your interactions with patients. So thank you. And thanks everybody. Thank you, everybody
You're
who's
welcome.
watching. Like I said earlier, we really just wanted to showcase and highlight all of the wonderful things that our nurses are doing across Minster Health Home Care. There are 176 of them working in various departments, from patient care through leadership to quality to education to clinical support services, making a positive impact. Like Sharon said, maybe not directly on patient care, but making a positive impact on all of the people who are providing care to our patients. So thank you again, and thank you all for watching. We'll see you all again soon in our next Nursing Spotlight. Thank you so much.